I had just arrived home. I put down my things, opened up my laptop, and began to read my emails. Admissions emails, delete. Homework notifications, delete. Spam, delete. And then I saw a peculiar email from one of my teachers. It read, "School will be out of session until further notice. Enjoy and hope to see you all after the break." I read it twice. As I reached for my phone, a surge of notifications came in. Hundreds upon hundreds of messages of people celebrating the prolonged break. But with this overwhelming rush of joy, many of us realized the true uncertainty that lay ahead. As you may already have guessed, I did not see that teacher after the break. In fact, none of us saw any of our teachers after the break. All we saw was a rectangular image of them as a once-in-a-century health crisis began to circle the globe. We now see that the younger generations took a particular hit to their mental health, as many of the events that we looked forward to were seemingly robbed from under our feet. Needless to say, the time that we spent locked away in our rooms with little to no social interaction is not something that we ever imagined, nor is it something that we were ever accustomed to, especially in this day and age of social media. Restrictions, regulations, and isolation has defined the times in which we have all come to suffer so greatly. Now, to get a grasp on the immense issue and the effects of this pandemic, we first have to see how things have changed. The US Census Bureau's 2019 National Health Interview Survey, also known as the NHIS, reported that 8% of US adults experienced symptoms of anxiety, while 7% experienced symptoms of depression. This shows us that there wasn't a high level of mental health cases in the United States before the pandemic. Now looking at the NHIS for 2020 shows a strong contrast to what we saw in 2019. 40% of US adults experienced at least one mental or behavioral system disorder. This includes PTSD, anxiety, depression, and acute stress disorder. Symptoms of anxiety and depression nearly tripled in the United States. Looking at the 18 to 24-year-old age group isn't any better. In fact, it's much, much worse. In this age group, 3 in 4 young adults experienced at least one symptom of a mental disorder. That's over 9 times the national average from the year before. Obviously, this is not a small problem, nor is it an isolated one. The Mental Health Foundation found that in the month of March 2020, 1 in 6 adults in the UK said that they were either worried or anxious, while 1 in 5 said that they were hopeless. Obviously, we're not alone. Like so many others, I sought out help. But that was the problem. So many others were struggling the same struggles I was facing. The already limited mental health resources available before the pandemic were now stretched extremely thin. I waited over a month for psychiatric assistance. That only proved to be ineffective. After finding another source for help, I waited over a month and a half on a waiting list just to get an appointment. In a time where 1 in 5 adults are either underinsured or don't have any insurance at all, I really am lucky to have the health insurance that covers the cost of therapy, psychiatry, and the medications that come with it. Now, to be quite honest with you, when I first started writing this speech, I was bewildered. I kept thinking to myself, how could we not have seen this coming? How can people think that mental health isn't real? And then I realized, not everyone has grown up with a grandmother and seen their decade-long struggle with bipolar disorder, only to find out that they too now suffer by the same name. I was lucky. I was very, very lucky. And even I am still trying to get a grasp on the effects of what I am dealing with. Now, if you ask any mental health expert, they will tell you that reducing the time between a person needing help and a person actually getting it is key to combating this new wave of mental illness. To be part of the solution, we first have to understand what those around us are dealing with. Every day we face challenges, and sometimes we fail to overcome them. Even if it's a small thing, we have to remember, to someone who sees the life as a losing game, the small things do matter. So instead of bringing each other down, we've got to do what we can to bring each other up. Here are a couple things you can do. First, you can ask your friend how their day is going and give them the space they really need to talk about what's on their mind without having to fear being judged. Another thing is staying in social contact. Giving them opportunities to focus on things other than what they're struggling with is key to stability in unstable times. And lastly, provide them with reassurance. More than anything else, they need to know that they aren't alone. So, make sure to do your part. We're all counting on it. Mental health is health, and mental illness is suffering. It's about time we started acting like it. Thank you.